One more time, my name is Dr. Akiba Green. We are here talking about a integrative cancer therapy. Really what we're looking at is a approach towards managing your condition that's both integrative, will work with a traditional, if that's the route you decide to go, or works as an alternative. And really the key thing is there's so much information that's out there. I want to go through a lot of this information with you guys. I want to give you, hopefully, a good overall understanding of what I do in the practice, what is available out there from a traditional sense. You're probably exposed to that a good bit, and from an alternative perspective, because there's a whole lot that gets missed over, and I think that there's some real concerns over therapies that have been shown worldwide to be really, really effective at helping patients, yet at the same time get almost no airplay at all in our country. It's a little bit of background on myself. First and foremost, I am a chiropractic physician. I love talking about why I'm a chiropractor, because we sit here and we talk about autoimmune disease with every one of my workshops that we do. Obviously cancer tonight. I do a lot of work with thyroid dysfunction, neuropathy, and diabetes as well. And the key thing is, as a chiropractor, my first most important concept is how can I help the patient naturally, without drugs, without surgery. And chiropractors do get pigeonholed into this musculoskeletal model. But as a core healthcare discipline, it's again based on this whole health approach. My specific training goes significantly deeper than the 9 years it took me to get through school. I am board certified in integrative medicine through the American Association of Integrative Medicine. I am board eligible as a clinical nutritionist through the American Board of Clinical Nutrition. I am currently enrolled and going through the University of South Florida Medical School's program associated with A4M, it's the Association for the Advancement in Anti-Aging Medicine. It's their Integrative Cancer Treatment Fellowship. And this is a 2-year program of study that really, what you see is a tremendous number of doctors. There are actually very few chiropractors that are involved in this program. It's kind of funny because you get there, you're talking with your peers about what you do in your practice, and you've got oncologists who are sick of going a traditional route. You've got internal medicine doctors who are looking for something fresh. And what do? I'm a chiropractor. You're almost like you see all these people, and they're like, wow, that's so cool. You can actually do everything that we're learning. Because so many of these doctors are pigeonholed. They can't practice the way they want to, or the way we learn, because of insurance, because of clinical guidelines that you see in these medical offices. In fact, a significant portion of these doctors actually end up going overseas and opening up clinics in Mexico or in Europe or the Caribbean. And they're great doctors. They do great things. They just can't practice here because of the concern of kind of the medical establishment. I've studied, I should say, under 3 docs that I like to mention. Dr. Datis Karazian, he's one of the top thyroid experts in the world. He is a great doctor. Wrote a book. He's got several books, but one of my favorites is Why Do I Still Have Thyroid Symptoms? My lab tests are normal. Dr. Kevin Connors, he is a practitioner. He is a practitioner in Minnesota, and he actually was a chiropractic physician, a chiropractic neurologist. He went through, he is a fellow from A4M in the Integrative Cancer Fellowship Program. He's a fellow in anti-aging. He gave up his license to practice under a pastoral medical license because the state of Minnesota did not like him helping patients. And there's been a lot of press actually nationwide about some of the cases he's helped with, especially with some of these really horrible issues of medulloblastoma, and really parents' choices getting taken away from them as far as the type of treatments that are done. He's a great doc. His book actually is required reading for all my patients when we're talking about cancer therapy, and he's got several books he's written. The great book, Stop Finding Cancer, Start Treating the Cause. It's a really good book. And Dr. Mike Johnson, he's in Appleton, Wisconsin. And he's an autoimmune expert, and it's what do you do when the medications don't work? It's just these docs have given me a tremendous amount of mentoring and training in addition to the actual fields of study that I've gone through, allows me to practice a neurometabolic model of care. It combines clinical nutrition, alternative therapies, functional neurology to really help our patients get the best chance towards health. Now, I've got some things I want to talk about tonight. First and foremost, I don't treat or cure cancer. This is really, really important for you to understand. I am not an oncologist. I am a chiropractor. And I'm here to help people who don't have anywhere else to go. And like I said, some of my patients come in and they're looking at going the traditional route. I know a few of you here, you're looking at going the traditional route and you want an integrative approach to make sure what happens after the therapies or the chemo or the radiation is done. But I exist for those who can't get help elsewhere. And with that, I do see patients a lot of times who they come to us as the last hope. So what I'm looking for is we're going to talk a lot about what those treatment options are. I think back to my aunt died of cancer 5 years ago, and we all have somebody personal that we've dealt with, and if we talk about what she went through, and going to the medical centers in Texas, coming home with these huge hopes, and then seeing those dashed hopes months later. When you look at that and you think, what I know now today, and what could it have done, or if there were other options that were out there for her. We got to go back to 1971 to talk about how long our country's been trying to fight cancer. And Nixon, he basically signed the National Cancer Act. I'll ask for an appropriation of an extra $100 million to launch an intensive campaign to find a cure for cancer. I'll ask later for whatever additional funds can be used. The time has come in America when the same kind of concentrated effort that split the atom and took man to the moon should be turned toward conquering this dread disease. Let us make a total national commitment to achieve this goal. And again, we're talking 41 years ago. In 1950, 193,000 people died per year of cancer. In 2005, 183,000 people died per year. What this tells us is we are no closer today than we were in 1950 in really curing cancer, in really beating it. We're losing this war that President Nixon started. The incidence is up 18%. The death rate is up 1%. In 1971, 1 in 20 people had cancer. Today, 1 in 2. There's no significant changes in survival in the last 25 years. And again, I'll give you stats. I've got research articles if you guys want them. And I have a couple of them in here. But everything we're seeing, and I'm quoting, is right out of the journals. So I want to talk a little bit about what cancer is and why we're no better at curing it. All of the cells in our body replicate. So we talk about cancer as this growth. Our cells are supposed to replicate. They're constantly reproducing. Cancer is when a cell doesn't die off. It continues to grow and grow and grow. And there's really two main types of cancer cells that we want to talk about. Something called an oncogene and something called a tumor suppressor gene. Oncogenes, watch your foot there. Oncogenes are basically genes that have the potential to cause cancer. They're mutated, something triggers them, and it causes them in tumor cells to express at a very high level. Tumor suppressor genes are, you can also call them an anti-oncogene if you want, but they're basically, it's a gene that protects a cell from cancer. It fights that process towards developing cancer. They've now come up with more than 100 known oncogenes. Some of the common ones, we've the HER2 for breast cancer, BCR-ABL for leukemia, CMYC for Burkitt's lymphoma, NMYC for some lung cancer and neuroblastoma. There's 100 different oncogenes plus that they've identified. With tumor suppressor genes, they detect growth that shouldn't be there in your cell. So they say, hey, something's going on, we got to do something about it. Some examples of those, P53, it prevents damaged DNA from replicating. So your cells get damaged and they're going to start growing. This is how your body identifies that and stops that from happening. RB, or retinoblastoma, is, again, it's a gene that regulates the actual replication itself. So in a cancer patient, you've got a higher level of oncogenes that get turned on and a lower level of suppressor genes. I say a higher level of suppressor genes that are turned off. So In a non-cancer patient, you've got a higher level of tumor suppressor genes turned on and a lower level of oncogenes turned off. The concept here is the body's either regulating itself right or it's regulating itself inversely. And if we talk about cancer, there's more than 100, or more than, I should say, 200 different types of cancers that they've established. They're named according to the organ in which they're found, even if it metastasizes. The name of the cancer is still where it was first identified. If we talk about breast cancer, we talk about brain cancer, lung cancer, skin cancer, obviously are examples of that. But cancer names can also be based on the type of tissues affected. Now, I'm not going to go into detail on the different types of cancer tonight. There are 6 main categories that all these hundreds of cancers fit into. Carcinoma, sarcoma, myeloma, leukemia, lymphoma, and mixed types. And I'd be more than happy to sit down, share that information if you want it, if it interests you. But what we're going to talk about tonight, again, I'm not here to cure you. I'm not here to treat your cancer. I'm here to increase the function of your immune system. So you have a higher level of immune suppressor genes turned on and a higher level of oncogenes turned off. We're here to talk about how we can get your immune system to help itself, to help take care of that cancer. What I do is I help you find the most effective approach to enhancing your immune system. It's got this cancer battle. We need to give it the best chance it has so you can live a long and happy life. We're going to talk about a whole bunch of natural protocols. How can we turn on those tumor suppressor genes? How can we turn off those oncogenes? A lot of this has to do with what your immune system is doing in your body. And I want to give you guys just a real basic concept. When we talk about your immune system, we're talking about something called Th1 and Th2. T helper 1 and Th2, there's 2 main parts. T helper 1 or Th1 is what we kind of call the Pac-Man of the body. It's going to help you get rid of infections. It's going to help you fight off disease. Th2 is that antibody production. The antibodies are what basically, it's like a memory marker, so your body knows what it's looking for. If it's a friend or a foe, it's how the body tracks that. Your Th1, Th2 should be in balance. In cancer, cancer cells produce killers to the Th1 system. Basically, your immune system's ability to fight and protect itself is damaged. The cancer attacks the body's ability to actually protect itself. If we're going to fix this, we have to talk about traditional approaches versus alternative approaches. Now, if we talk about traditional approaches to kill cancer cells, obviously chemotherapy and radiation, surgery to remove the tumor. There's natural chemotherapies. There are several treatments that some docs do in this country. Sometimes you have to go elsewhere where they will actually help regenerate and use a chemical to help kill off the therapies, and they're not the same thing as what you would see with an oncologist. There are immune stimulation or regulation tools, detoxification tools, waveform excitation. These are traditional approaches for the most part. It's kind of, what are you to do? You're told, and again, I know how scary it is when you're told you have a tumor and you have to do this treatment. You don't have another choice. This is the way you have to go. But there's a huge problem with the traditional approach. And if you only go that route, I think that there's some big things that patients are missing. And number one, we are afraid when we're told you have to do something. Fear is a motivating factor. It causes you to run down the road of cancer. Are you going to cut? You're going to do surgery. You're going to do chemo. You're going to do radiation care. You're scared. That's what they tell you to do. I'll share a couple stories of patients that I've dealt with over the years that I've known. And as we talk about, one of these that really continues to stick with me is of a patient who basically the oncologist said, we have to do chemo. Looking at your CT scan, you're going to basically die if we don't do this in the next few weeks. And she proceeds, does the chemo, and she follows up with a colleague of mine. And it's, hey, how are you doing? I'm doing horrible. The chemo's making me feel horrible. So, but can you please talk to the oncologist? Can you please talk to him? Before I do the next round, can you talk to him? And she brought in to my colleague the CT scan. And the CT scan was from the day before they started chemo. Now, the oncologist had told the patient, if you don't do chemo, you're going to die in weeks. The CT scan that he was looking at was from 6 months prior. And in fact, the CT scan report of the day before they started chemo, the radiologist, now when I read a radiology report, they're really boring. It's like a typewriter, single type line. The radiologist had bold typed, underlined, no change in cyst formation. So you're telling me in 6 months there was no change at all. The oncologist is looking at an old CT scan, proceeds with treatment based on that. The patient does worse, and at the end of the day, the oncologist said, I guess we're not doing chemo anymore. And that was it. And it just, and you can, we all know these stories. Cancer surgery does decrease your immunity, so around the site of the operation. And that actually supports cancer growth. It supports the ability to have metastasis. If I cut that tumor out, research shows that it could spread elsewhere because of the cells getting inflamed around it. If we remove those factors, you know what, but you could potentially accelerate it. So as we talk about what can happen with this traditional approach, chemotherapy will slow down a fast, rapidly growing cancer because it will suppress the immune system. And if we think about it, the goal is to, it's a form of poison. The goal is to kill the cancer before we kill the person. The problem with this approach, is there's two cells. They're called circulating tumor cells, CTCs, and cancer stem cells. And they're in the body, and they're not eliminated with chemo. They're already beyond the site that we're dealing with. And, so when you do the treatments, you may see the cancer's gone. But then down the road, whether it's weeks, months, or years, it comes back somewhere else because those cancer cells are staying in the body. The biggest question that nobody asks, and none of the traditional doctors answer, is why did the cancer start in the first place? What caused your immune system to create this tumor? What can be done? So you go through treatment, a successful surgery, and we all have friends who beat cancer. You have a successful surgery, and you go through, and then, well, what now? Is it going to come back? You always have that fear over there because nothing was done to identify what your immune system was doing to head to that immune dominance and create that problem in the first place. And, again, billions spent, the reality is we're closer to winning the war on cancer. 5 studies, and I've got the references there. Again, if we talk about what I'm saying, and this is not just my opinion, if I really hammer this, if you manipulate the tumor, it actually releases tumor cells into the bloodstream. If you remove the primary tumor and the factors that were inhibiting that angiogenesis, that tumor development, it's going to cause other parts of the body to not be able to fight off that development. Tumor growth factors and inflammatory cells, cytokines, are released when you do the surgery. And we talk about that cell-mediated immunity, that Th2 and Th1, that Th1 system. You talk about it gets suppressed. It can't fight off the infections when you go through with traditional treatment. So, if we talk about chemo and survival rates, they had a 5-year study. This was done in clinical oncology. It was published in 2004, and it was done in Australia. And what's really alarming about this study is if we look at these survival rates, from 1989 to 1993, all stages of cancer had a survival rate of 53% or 63%. We're talking about colon and rectal cancer, in this case specifically. Stage 1 had an 84% success rate. Stage 4 had a 7% success rate. If we look at, fast forward to 2000, 2005, and we see stage 4, you've gone from 7% to 8%. We see stage 1, you've gone from 84% to 90%. But all stages overall, you've gone from 63 to 65%. So, what the study showed was there's a contribution in your 5-year survival rate of 2.3% in that time frame. In the U.S., it was 2.1%. That study was done in Australia. The median survival in lung cancer has increased 2 months in the past 20 years. And overall, the survival benefit of going through some of these treatments has shown for breast, colon, head, and neck cancers 5% or less. increased benefit. So, listen, I don't want, and this is the last thing we're looking at. If we talk about just the problem with our current system, I'm not saying there's never a time that we need to use chemo or radiation. But if we talk about where we're seeing benefit, so let's talk about significantly extended 5-year survival rates. Testicular, 41%. Hodgkin's disease, 38%. Non-Hodgkin's lymphoma, 10.5%. Ovarian, 8.8%. So what we're seeing here is these cancers are not getting beat by the traditional approach. And if you get into the real nitty-gritty, the Journal of Oncology published the average cancer patient is worth nearly $300,000 to the hospitals and doctors who land the big fish. And I hate to say it that way, but I've got a patient, a neuropathy patient. Every month, he has to go get an IVIG injection. This injection is paid by his insurance. If he doesn't get this injection, his feet burn, his hands burn constantly. Each injection costs his insurance $20,000. He did that for 2 years before he came to me. He's now been with me 7 weeks, and his last injection was 7 weeks ago, and he may never have to get another one. And it's kind of neat. It really is neat to see what we've done with him. But the key thing, my wife actually said, you got to watch out for a car bomb in my car. And you never know. I mean, I'm taking that much money away from that doctor. But it's a grim picture, but it's a reality. The problem is, you may need chemo, you may need radiation, but to ignore alternative approaches, to say, if we're trying to promote the patient's internal environment, if we're trying to maximize your healing potential, to do nothing other than just go down one route, it's a travesty. It really is. And the funny thing is, these problems that we're seeing are problems with the traditional approach only. If we talk about all these different, again, Suzanne Summers, these names that are out there, and there's so many books on how to naturally outsmart cancer, how to beat your cancer. And the key thing is, all these people survived. That's why they wrote a book. And they didn't have any of the negative effects of the traditional approach. And, if we talk about that, but, Dr. Connor is a good colleague of mine. This is a great quote. I love this. The serious clinician will come to the conclusion that successful supportive care of someone diagnosed with cancer is to get them from an acute, life-threatening, or terminal disease into a chronic, manageable condition. That seems like a really good goal. And there are natural protocols that can help turn on those suppressor genes and turn off those oncogenes. But many people don't realize that some of these natural protocols can actually make you worse. And you got to be careful with the approach you do. If used incorrectly, the natural protocols can increase your oncogenes and decrease your tumor suppressor genes. And obviously we're talking life and death here, so it's very serious to know that we're taking the right tools. A couple quick examples. A patient was taking pine bark, green tea. Have you guys heard of these? Has anybody, these are supplements, right? These are immune supplements. Her cancer got worse. TH2 support, pine bark, green tea, grapeseed, resveratrol, lycopene, caffeine. All cancers are a TH2 dominant immune problem. If you take a TH2 stimulant, you're going to make your cancer worse. You think you're helping your body, and you're not. TH1 support. So vitamin A, vitamin C, zinc, astragalus, echinacea, licorice, lemon balm, mushrooms, garlic. We'll talk about some more TH1 support. TH1 is great. But, a patient was taking Protocell, and that targets the anaerobic cells, so certain types of tumors. His cancer got worse. How about IP6? And her cancer got worse. The Gerson method, and we'll talk a little bit about that as well, the cancer got worse. We said, why? Why did the cancer get worse when they did these things that we've all heard help cancers? The reason is because your individual immune system needs a certain type of support that somebody else's doesn't. And you have to have your body looked at. You have to have it tested to determine what your immune system needs to do. We talk about the gut, we talk about a lot of these areas, but even wheat germ therapy, even IV glutathione. Again, you think of things that are good. So the questions become: I have X type of cancer. What is the best natural approach? I have, this problem. Off the top of your head, what should I do? What's going to help me? Give me something quick that'll help me. There's so many alternative approaches. What's best for you? If we talk about Gerson method, we're talking about juicing, and there's a lot that's been written on. I've got a lot of great resources through the A4M Integrative Cancer Fellowship, and there's plenty of great sources that are out there as well on what juices to use, on what vegetables to use, on what not to use, how much to use, what juicers are going to help make sure that the enzymes in the juices don't get, or in the vegetables and juices and fruit themselves don't get destroyed. Coffee enemas. This is something else. If you haven't heard of this, you have to do this. And I will talk about this more, but this is such a huge, there is nothing that will help your liver detoxify better than a coffee enema. I know it sounds kind of weird. I understand that, okay? But we're talking about cancer. We're talking about life and death. It doesn't matter how weird it is, okay? Research shows coffee enemas work. I can tell you, those patients that I've talked to who perform these, those patients and colleagues who use this with their patients, better outcomes. It always is, and it's going to help. And there are patients who can't do this, not because it is what it is, but because of other reasons. So there are some alternatives. They're not as good. They really aren't. A vegetarian diet for some people. And if we talk about diets, Dr. Kelly, this is a great, great book. drkelly.info. He sells a book. He's way long dead. His company, though, he wrote this book. His company's still around. They sell this book. And it's metabolic typing. So it's what does your body want? And what the book is actually a very huge test. And you go through the questionnaires, and then you send the test off, and you get answers as to what your body needs. Are you somebody who needs to be on a vegetarian diet? Are you somebody who needs some fish? Are you somebody who needs red meat as being good for you? This book helps you identify what your body wants. And again, we talk about these systems are out there, and we talk about the success that they've had in using metabolic typing as a tool. There's a diet, the cancer diet, eating God's way for cancer. And you talk about good quality meats, wild caught only fish. They say the fish must be with fins and scales, no catfish. And they get detailed. So some of these techniques are out there, and it's why do you do a certain thing? It's the Budwig diet. They use flaxseed to detox, and you've got Kelly. There's these high doses of enzymes. There's one doctor you go to his clinic, and he's going to pump you full of just huge amounts of enzymes to treat you. Gonzalez, mega dose vitamins. You've got Gerson, we talked about SEACT. Dr. Simoncini uses fungus to help treat. You've got Hoxie method, uses tonics that they make. IV vitamin C, Holder Clark with parasites and flukes. There's so many different diets, plans, and protocols that are out there. The reality is you need an integrative approach. What I do is I take all those different systems, and we know that you have a diagnosis. Cancer being the ultimate chronic illness. Your body's been sick for years. You've got this label. We have to look at what's impacting your immune system. Now, some of you have heard this before. I call this the web of physiological dysfunction. What this means is you have multiple different things impacting your immune health. And if you look at that list, again, blood sugar issues, adrenal issues, gut issues, thyroid issues, hormones, liver, and obviously we're talking about an immune system problem, the brain, mind-body issues, okay, emotions. Gut dysfunction is a huge component of this. 80% of our immune system, and as a cancer patient, it's a Th2 dominant immune system we're dealing with, an autoimmune attack on your body. 80% of that immune system is in your gut. So we have to make sure that your gut is functioning properly. Blood sugar dysregulation. Blood sugar is a huge thing that impacts that immune response. Inflammation. Are there autoimmune diseases elsewhere that we're also dealing with? Brain, neurotransmitter dysfunction, anemia, lymphatic dysfunction, another huge area. If we talk about the lymphatic system is designed to help drain and move nutrients where they need to be. When we talk about a surgery to remove a tumor cell, one of the things that they often do is they remove the lymph nodes as well. If we really talk about why those lymph nodes are there, the circulating tumor cells are already in your body. If you have breast cancer, the CTCs are in your feet. We all have them. and they've already gotten where they needed before you even went to the oncologist. So by removing the lymph nodes, you're actually potentially making it harder for your body to help get tissues where it needs to be to heal. You know, and it's this issue where it's, hey, we can attack, we can remove, we can block it, or we can work to get the body to do what it's supposed to do and try to rebalance itself out. Again, liver, gallbladder issues, thyroid dysfunction, fatty acid metabolism, how about carbohydrate metabolism, energy production markers, EMFs. This is another huge thing that we have to talk about. You know, we're talking about, is your house grounded properly? Is there stray electricity that's getting there from your circuit breaker in your garage into your house? Do we have an issue? If you look at the research on cell phones, and actually not even cell phones, but cordless phones in Europe, where they've done a lot of research on this, it's scary. I mean, we talk about brain cancers, it's really scary. If you have EMFs, if you've got these electromagnetic fields that are impacting your health, you have to address them. Dental work, infections. We talk about dental infections, we talk about amalgams, heavy metals, toxicity issues. So all these different issues, if we're going to get maximum healing out of your body, we have to address everything so your body is functioning optimally. And really what we're looking for is a balanced immune system. And again, you've got this cancer problem where it's at Th2 dominance. We want to get your body where it balances itself out and it can regulate what's thrown at it. You can have an autoimmunity, you can have an allergic reaction, infection, but at the same time, your body should be able to handle whatever's there, and it's not for some reason. When I run testing, I run blood work on my patients. I use what I call a Chem 70. We talk about blood glucose, liver, kidneys, gallbladders, all the basic panels. We're going to look at iron, ferritin, B12, folic acid. Methylation is a huge thing problem that I see. CRP, homocysteine, inflammatory markers, vitamin D, CBC, full thyroid panel, lipids, all these basic tests. You go to your doc, they say we're going to run a lot of tests, and they run usually 20 tests, and they'll do a screening test here and a screening test there, and they say everything looks good because everything screened was fine, but they didn't look at any one area with enough tests to really know what was going on. I do a lot of food sensitivity testing in my practice. Again, we talk about things that drive the immune system. Gut problems, leaky gut. Do we have an issue with autoimmunity? Do we have an issue with bacterial issues? An issue with foods that we're eating? Maybe gluten. Gluten is a link. There are actually now, I think, 3 published cases, interesting, linking ALS, Lou Gehrig's disease, to gluten sensitivity. Really fascinating. And I'm going to be really curious to see where that goes because New England Journal of Medicine links 55 diseases to gluten now, and it's a huge issue. Other foods, dairy, soy, egg. Some people are great with them. Some people, if your immune system is attacking your body because you eat a food, that means when you eat that food, your immune system is potentially attacking your body's ability to fight off those cancers. An organic acid panel. I use a lab called Metametrics to do a couple of these tests. This is a great panel. What it does is it looks for deficiencies. Fatty acid metabolism, carbohydrate, energy production, B complex, methylation, detoxification markers, things that are impairing your body's ability to regulate that immune response properly. We've got an autoimmune condition. We got to figure out, could it be driven by an antigen? If you go back to early cancer research, they said a virus drives it. Something, an antigen, is driving and attacking and causing the cancers. It could be a parasite. It could be mold. It could be a fungus. It could be bacterial infections. One of the tests that I use is a stool test from Metametrics. It's 100 times more sensitive than one I can get through Quest or LabCorp. It's a really good panel to look for infections. I do hormones. We talk about, we have a chronic condition, your body's under a tremendous amount of stress. Your adrenal gland is something I want to look at. I talk about your adrenal function. I do a saliva test, a salivary hormone test to look at your adrenals. I talk about your sex hormones. Prostate cancer is a classic example of an imbalance in a male between estrogen and testosterone. So we can look for that. We can help identify that through hormone panels. If we talk about these tests, one thing I want to just touch on is there are a couple tests that are out there as well. So, I've had some patients where everything pointed towards cancer with the patient. And the docs just didn't want, you'll just eat better, exercise, whatever. I mean, literally, ominous signs on lab work, and the doctors didn't want to do anything. So there are tests that are out there. There's a test called anti-malignant antibody screening test, and it actually, the research shows it's got a 93% rate of not having false negatives and a 95% rate of not having false positives. So it's a really good test for non-malignant cancers. If we're thinking we're dealing with cancer, it's a blood test, and you go through the lab specifically. You get your blood drawn locally, they dry ice it out to lab, and then we get the test back a couple of days later. There's another test called a Navarro test, and this is a great one. If you have cancer, this is a great test for you. It's a test that looks at your urine, and it looks for a form of growth hormone. And it's not good at identifying yes or no for cancer, but it's good at seeing if there's a change in your body. Because you get a baseline, and then you can retest, and the test is cheap, and you do it at home, and you mail it off. And if it changes, then you know your body is either doing a better job at fighting and turning off those oncogenes, or it's doing a worse job. Is your cancer getting better or worse? And it can tell you that. So it's a great, great test to use, and you can do it. You can do it on your own. I can give you the website of where to go to get the kit, or you can actually buy, ammonia and some supplies and prep the kit yourself. But it's a great tool to use. Navarro is the name of it. Now, if we talk about supplements, there's so many supplements that help maximize your healing potential. They increase or switch on those good genes. So we're going to get those tumor suppressor genes turned on, and we're going to turn off the oncogenes. Mushrooms are a great, great tool for certain patients. Some of this list, it's shown to enhance tumor-killing effects of immune cells. So we talk about medicinal mushrooms, beta-glucan, protocell. One I want to mention is Hyalin 951. I don't know, I may have a page on this one. I'm going to come back to it. If I don't have a page, I'll mention it. Astragalus, echinacea, again, vitamin C, Th1 stimulants. Antioxidants, you want to be careful with things like CoQ10 and glutathione, depending on what we're dealing with cancer-wise, because they can actually stimulate certain types of cancer as well. So again, we talk about, you'd be surprised at what you think is really good for you, what's actually happening when that nutrient is digested in your body, and how it's responded. Milk thistle, again, we talk about things that can help fight cancer-developing cells. Milk thistle, quercetin, and Chinese wormwood. Some great studies that have shown benefit with those supplements. Hyalin 951 for certain types of cancer. This may be something that, for ovarian cancer, we want to talk about. It is a fermented soy beverage. Research has shown that it helps reduce adverse side effects of chemotherapy and radiation. They had 318 patients tested. 276 were receiving chemo, and the balance were receiving radiation. And it reduced side effects, and none of the patients needed a blood transfusion, and none of them had to discontinue any course of treatment because of physical weakness. This is a great, great product. It shuts down those cancer-developing, the anti-angiogenesis. It shuts down those cancer-developing cells. It helps make sure, apoptosis, what we're talking about is the body's ability to identify and stop a cancer cell from developing, or the body's ability to reduce the cancer cells themselves. And this helps slow those issues. The downside is you buy it directly from Hyalin, it is expensive. And the way you drink it is a half a bottle in the morning, a half a bottle in the evening, and a bottle costs $50. It's expensive. But I can tell you, a $1,000 investment through their company for a month's supply may be the difference for somebody going through chemo. And if that's what it matters, it doesn't matter. If that's what it is, it's something to consider. Curcumin. I love curcumin. I use a product called co-curcumin from Ayush Herbs. It's a really messy, orangish yellow powder, but it has coconut oil mixed in with it. It's got black pepper mixed in with it, so the body uses it. And it's got a great, great dose for brain problems, for inflammation. We talk about all these, boswellia, curcumin, ginger, white willow extract. These all help block COX pathways. So we're talking these inflammatory pathways. Modified citrus pectin. This is another one of those really great, great tools for certain types of cancers. Basically, it binds to the circulating tumor cells. There's only two things that research has shown that can remove CTCs. modified citrus pectin, and Tagamet. That's who would have thought that, Tagamet. But yeah, if somebody's on Tagamet, I'm not going to necessarily take them off of it because of that benefit. What happens is the pectin, the citrus pectin, it comes from apples, citrus fruits, plums, and it's a fiber. It's a soluble fiber. It's not absorbed, and they alter it so the modified citrus pectin can be absorbed, and then it binds to the actual circulating tumor cells, and then it kind of pulls them out of the body. And for prostate cancers and melanoma, this is a great, great tool. It can also strengthen T cells. It's got some good chelating effects to it. Again, it's a tool that I use as a general supplement in my own personal arsenal as well. Green tea extract. Again, green tea is a Th2 stimulant. Green tea decreases IO6 levels, and it actually inhibits the vasculature nature that helps cancer tissues grow. So it has a tremendous benefit for cancer patients. But if you go on green tea, you got to go on a lot more Th1 stuff to balance it out. But there's definitely benefit with it. Sea cucumber extract as well. And again, we talk about how it can break down that cancer wall and destroy those cells. So, and just a couple studies on again, the green tea and how it inhibits that tumor growth. So how do you know which one to use? That's where I come in. We use individually tailored nutritional protocols. What does your body need for maximum healing is going to be different than what your body needs. And no two patients are alike. And so we have to base it on what your labs show. We have to base it on what your body responds to. We have to base it on, and I use labs. I use, one of the therapies I use is called Rife therapy, and I'll touch on it again in a second. And it has some great diagnostic tools with it, even though it's not really a diagnosis tool in itself. And the more and more I'm helping these patients, we talk about muscle testing, the ability to directly test the patient to see how they respond. My goal is to find the one that's best for you. What natural protocol is going to enhance your immune system in its fight to get rid of the cancer? And what gives you the best chance? We got to help detox your body. This is a huge, huge part of how I'm going to help you. If you've gone through chemo and radiation, you need more detox. If you haven't gone through chemo and radiation, we have to detox your body so it can work on its own. Modified Gerson. So Gerson's got some good stuff. All these techniques have some good stuff. There's some things that go too far with it as well. Juicing organic vegetables. Again, coffee enemas really help detoxify the liver. You want to make sure that's what you need. The Rife therapy, and we also use the ionic foot bath for very specific patients as well. It's a light wave therapy. And has anybody here heard of Rife other than, let's see. So,
Dr. Whitaker.
Okay. So Rife therapy, in essence, is an ultrasound frequency that rides on. It's a light wave that has these electro frequencies that go into your body, and it's able to. And goodness, the government did a lot of this research for us, but Dr. Royal Rife back in the 20s and 30s identified all these frequencies for different conditions. Cancers, Lyme's disease, parasites, you name it. Frequencies were established, and our body is just electrons, and we've got frequency in everything that we do in nature. So what the Rife does is it looks for frequencies, and it helps identify what frequencies your body needs. I actually can use it as a form of a diagnostic tool to identify what your body needs if we don't know. And then we use it as a treatment either in the office or at home. And Rife therapy it's not necessarily the cheapest thing in the world, but it's something that can be purchased from the manufacturer, and people sleep with that. And if you've got this light tube that won't break on you, I program the Rife in so you get 7 hours, 6 hours of therapy every night. Or sometimes we'll do it in a day. If you can't get out of bed, we'll do a day program as well. And it's helping to change the environment your body lives in. It's helping to detox. It's helping to get your pH where it needs to be. It's helping to get your body to kill those cells. Mud packs. So if we have EMFs, if we have dental infections, there's actually something we use with aloe vera, these little pellets that you make that you put in, you keep in your mouth. It helps kill off certain infections that are impacting your immune system from your teeth. You can mud pack a scar And again, we talk about interference fields, and some of this stuff, if you talk about it, it's I'll be the first person to say some of the things that I know help cancer patients are out there, but I don't care how far out there if it's helping somebody. And that's where you have to go, and you have to keep an open mind when you talk about that aspect of it. You can't discount the issues of EMFs, interference fields, and dental work. And again, that's at Rife Therapy. We're talking about itself. Mm-hmm. Okay. So that's what it looks like. And so actually there's a bulb. Looks kind of similar to that, a bigger, longer one that you just hold at home. Or you just keep it in your bed with you, and you get the therapy, the frequencies go right in. It's a great tool. I mean, I can tell you, I mean, again, the number of patients I know that my colleagues have seen get better from cancer with Rife Therapy. I mean, it's up there at the top of the list. So we also use brain-based therapy. We give you oxygen. Some patients will get an oxygen concentrator for home. Cancer cells thrive on sugar. 8 times the normal amount of a cell. So, you get that sugar, you have a lack of oxygen. So we need to give you that fuel. We need to give you oxygen back into the body to help balance that out. I've got patients who, all I want to do is eat cake. That's all I want to do. All I want to do is eat cake. And it's just, I mean, that's what their cancer cells are telling them. We have to offset that. You have to find a way to balance that out. Of course, nutritional testing, based on lab testing, based on kinesiology, what supplements are going to help your cancer most effectively, and neurological testing and support. So, if we talk about the approach in an integrative model, for some patients, it's an issue of you have cancer, you're going a traditional route, chemo radiation is in your future, that's what you're doing. And if that's your decision, honestly, you pray to yourself, you pray to and you figure out what you want to do, and that's the path that you do, as long as you have the information. But once you're done and you make it through that journey, what's going on with your body? Is your immune system in a position where it's not going to come back? Are the problems still there? And that's the biggest thing that we look for. And I hope this makes sense. This concept makes sense of looking to see answer the question why your immune system is attacking and leading to your cancer development. If you like what you've heard, what I'm doing tonight, this is really, it's information, but if I can help you in any way, action is how you're going to get better. And I'd be more than willing to sit down with you guys, and we can make an appointment for a consultation and see if I can help you in your situation. Keep in mind, a diagnosis of cancer is not a death sentence. It's absolutely not. And there's a couple things you can do right now. I want to leave you guys with this. It's no refined sugar. Change your diet. No high fructose corn syrup. No soda. No red meat. No caffeine. No alcohol. No white flour, fruit juices, high saturated fats, trans fats, food additives, coloring agents, junk. Some of the supplements that you guys take have what are called excipients in them. They're just as much junk as a Mountain Dew. And keep that in mind, that you think you're taking something that's helping you, and there could be all these fillers that are in there. Definitely no junk food. Increase the amount of fresh organic vegetables in your diet. No or very limited fruits. Stone fruits are what I always recommend. A stone fruit, pears, plums, peaches, nectarines, avocados. The fruit, the pit, sloughs off and creates the fruit. So it's a fibrous fruit. You're going to have a much better blood sugar regulation with that. Grass-fed chicken and fish, organic if you can. And again, very limited red meat. No glutamine, no glutathione, no CoQ10. You got to make sure that you're not doing things that are going to push your body the wrong way. And do what you can to detox on your own. Massage, sauna, steam rooms, distilled water. No alkaline water. Okay? We know, and I didn't talk about this, but cancer thrives in an acidic environment. Okay, so we say we want to get alkaline. We want to have a higher pH. Yes, we do. Alkaline water does not do that. What alkaline water does is it causes your stomach acid to get reduced. You need stomach acid to fight off and function properly. If you don't, it's called hypochlorhydria. If you don't have good stomach acid, you're not going to get anywhere else. So alkaline water is not the solution.
What's alkaline water?
It's, alkaline, yeah, it's, alkaline water is literally that. There are systems that you can buy, like $4,000.
Well, a bottle of Dasani or something.
So distilled water. If you're gonna drink water, I want you.
Distilled, it's
So correct. So that's called tap water.
Is that alkaline?
So it is not. No, that's not alkaline water, but that's tap water, and that's also not going to be. No, that's actually not going to be that good for you. If we really talk about what you need, you want distilled water. Reverse osmosis, I'm okay with ROS. Reverse osmosis is a good system if you have it in your house. But from a water point of view, distilled water, because it's going to be a slightly higher pH. But it's not going to mess up with your stomach. And also, I love like the San Pellegrino and LaCroix. Those two, especially San Pellegrino, it tests out from a toxicity point of view really well. And if you're looking for something to drink, again, you may not be able to buy that many of them, but it's something that you can do. But just distilled water, or even just reverse osmosis, filtered water. But alkaline water, Kangen is one of the main ones that's out there, and a lot of the health food stores you can fill things of it, and it's people swear by it. I can tell you it doesn't really work.
A question: you say no fruit, except stone fruits?
Correct.
The berries?
Why no fruit?
Well, the reasoning for this twofold. One, from a Gerson perspective. Okay, if we talk about the research that Gerson has done with fruit, but most importantly, it's a sugar. It's a sugar concept. Stone fruits have low sugar. Here's the one thing I'm telling you. These are things that you guys can do. Don't go to any doctor. You can do these things right now. You may need to eat certain fruits. That may be beneficial for you. There may be a patient who has an allergy to rice, but they have to eat rice cakes to help their blood sugar up that night, and that's okay. So keep in mind, what's specific for Patty may not be specific as a general concept. Vitamin D, get out in the sun. A lot of people, though, don't get enough vitamin D in their body, even with the sun. So that's one of the things we look for with testing. Metabolic typing, Dr. Kelly's book. Modified citrus pectin. There's something, it's called galactin-3 protein. It's one of the huge cells that stimulates and increases cancer. And the modified citrus pectin, we talk about those circulating tumor cells, it pulls them out. Isaac Elias, if you've never heard of him, he's a great resource on the web. He's got a lot of really good just alternative cancer information. Modified citrus pectin would be a multi-billion-dollar drug if it could be patented, but it can't be. So we can all buy it, luckily. Thank you guys.